Hello and welcome to the Switchboard webinar on rapid community assessments with refugee newcomer populations. We'll give folks about 30 more seconds to join, and then we'll get started. Welcome again, everybody. Let's start the top of our webinar with our quick overview of your settings in Zoom. This is a Zoom webinar, so you're joining on listen-only mode. Due to the large number of learners on today's webinar, we've disabled the chat box. However, you do have the option to send messages to the speakers and co-facilitators via the Q&A. Keep an eye on the chat for messages from Switchboard and links to various resources that we'll be mentioning throughout today's presentation. Today's webinar will run for a total of 75 minutes and is being recorded. You'll receive an email with the recording, slides, and recommended resources within 24 hours. The webinar transcript, along with the recording, will also be posted on the Switchboard website within the following days. Last, we ask that you kindly complete our webinar satisfaction survey at the conclusion of our session. This short 3-question survey helps us here at Switchboard to continuously improve our training and technical assistance offerings to you all. And with that, it's my pleasure to introduce Dr. Mary Bunn, PhD, LCSW. Dr. Mary Bunn is a licensed clinical social worker and an assistant professor in the Department of Psychiatry at the University of Illinois, Chicago. Her work focuses on the development of community-based mental health interventions that improve mental health and strengthen families and social systems of care and connection. Welcome, Mary.
Thank you, Rosalie. And thank you all for attending our presentation today. We're excited about what we have in store. My role today is going to be the webinar moderator. And so now I want to spend a few moments introducing the rest of our panelists for today. Ramsha is working as a research associate in the Department of Psychiatry at the University of Illinois, Chicago. She previously worked as a research assistant at the research program on children and adversity at the School of Social Work at Boston College and has over 6 years of research experience working with women and refugee communities. Dr. Karin Wachter is an associate professor at Arizona State University School of Social Work. Her background is in international humanitarian assistance, and her research focuses on violence against women and social support in war, forced migration, and refugee resettlement. Also joining us is Caroline Diltz, who is working as the Refugee Program Manager at the Research Program for Children in Adversity at the Boston College School of Social Work. She has over 7 years of clinical social work experience. Her current work focuses on strengthening resettled Afghan families through the Family Strengthening Intervention for Refugees, an evidence-based program that promotes mental health and stronger family relationships. At this point, I'm going to turn it over to Ramsha, who's going to guide us through the first part of our webinar.
Hello, everyone. I'll be starting the presentation with the learning objectives that we'll be covering in this session. Number 1, describe what a rapid community assessment is and why to conduct one. Number 2, describe how to prepare for a rapid community assessment and the different data collection approaches that can be used. Number 3, recognize ethical considerations while conducting rapid community assessments. And number 4, name at least one practical application of rapid community assessments. I'll be covering objectives 1 to 3, and my colleague Karin will be covering number 4. So we'll be beginning our presentation with a very fun Slido. You could scan the QR code available on your screens with your mobile devices, or you could go at slido.com and enter the code to take part in this poll. The question we have for you is this the first time you're hearing about a rapid community assessment? And we have a lot of people that are saying yes. So majority of people are saying yes. So we have 75 people are saying that they're hearing it for the first time, and some people have heard it before and some have not heard about it before. So that's great. We're all here to learn, and hopefully once you're done with the presentation, you'll know what it is. Let's move on to the overview of rapid community assessments, and we'll be starting with the definition of what a rapid community assessment is. Next slide. Thank you. A rapid community assessment is a streamlined approach to swiftly gather community insights on the major needs of the community. These assessments are often used to determine specific physical and mental health problems, to identify risk and protective factors, and to assess issues that may inform access and utilization of services. For today's presentation, we will focus on how a rapid community assessment can be planned to be used for refugee services. Before we move to the preparation of a rapid community assessment, let's discuss the rationale behind using a rapid community assessment. The overall benefit of an assessment like this is that it can be conducted to understand the needs of the community. It can also be used to rapidly learn about the refugee and newcomer needs because you can conduct it in a very urgent or time-sensitive manner. It can be utilized to understand the demographics and social culture characteristics within the community so as to tailor or develop appropriate services quickly. A rapid community assessment allows you to build relationships with the community, with the refugee and newcomer populations, and understand their needs and opinions about various issues much better. Moving on, we have involvement of community. A rapid community assessment can increase the community's sense of ownership and empowerment. It can also help in receiving first-hand information from the communities we serve. A rapid community assessment can also be used to document the needs of the community so future projects and programs are aligned to meet the needs and can help the community as they go. Financial support. A rapid community assessment can also act as a great tool for attracting funding for the refugee and newcomer population in times of need by identifying areas of need and investment. And lastly, organizational capacity. The data from a rapid community assessment can be used to effectively organize staff, relationships with other organizations, and procedures to proactively address a certain issue or trend. We'll be moving on to the impact of a rapid community assessment. And starting off, we have advocacy purposes. This assessment helps identify the key issues and challenges faced by a community. By collecting data on social determinants of health, community needs, and barriers to access services, it provides a comprehensive understanding of the community's concerns. This information can be used to prioritize advocacy efforts and focus on addressing the most pressing issues affecting the community. You can also use the data you collected in the assessment to write proposal and design programs. Policymakers, service providers, and even healthcare professionals can use this information to make informed choices about resource allocation, program development, and policy implementation. Community assessments often highlight disparities and inequities within the refugee community. Evaluating client outcomes in light of these disparities can help identify if certain subgroups or populations are disproportionately affected by poor outcomes. This information can inform targeted interventions to address the underlying causes of disparities and improve outcomes for marginalized or vulnerable populations. And lastly, rapid community assessment often involves collaboration among various stakeholders, including community members, healthcare providers, local government agencies, and community-based organizations. This collaborative approach fosters partnership and promotes community engagement. It allows for a more comprehensive understanding of the community's strengths and challenges and encourages shared responsibility and enhances the effectiveness of interventions and programs. Let's move on to another interactive activity that we have. The same way, you will have to scan the QR code on your mobile devices, or you can join us slido.com. The code is right on your screen. The question we have for you this time is, what could be some potential areas of focus for conducting a rapid assessment within your organization? So if you're coming from a refugee service organization, would you want to conduct a rapid community assessment on, let's say, mental health? Or would you want to conduct it on education or access to different resources? What are the different topics that you can think of? So we have somebody saying mental health. We have health access, social adjustment, healthcare. We're getting a lot of good ones here. Legal aid, trauma. I see trauma. And then we have education, access to resources, a woman empowerment. That's a very good one. Yeah, so I'm glad that you're getting the gist of this. So let's move on to the section 2. And for section 2, we'll start by discussing how to prepare the different steps that you can take to prepare for a rapid community assessment. I'm briefly going to explain these steps, and Karin will demonstrate an example of a project that followed all these steps. Starting with number 1. For a faster turnaround, it is important to identify key refugee and newcomer service organizations or partners willing to help and coordinate with you. This will also provide access to a number of trained employees and help in building future connections. Connecting with other refugee and newcomer service organizations may also give access to more individuals from the community who can give you feedback and assessment. Number 2, in addition to needing sufficient budget for the project, you would also need to make sure you have enough funds to pay your team members, carry out the assessment, and have enough budget for providing incentives to the community. Number 3, with refugee and newcomer populations, it is important to ensure that you have a well-trained team that can speak the language for ease in data collection or have access to interpreters. Hiring project staff and volunteers from the refugee community and the newcomer population can be very helpful because of their already established links with the community. Number 4, try to recruit participants representing a broad range of sectors from within the key community. Include people from different genders, ethnicities, educations, backgrounds, occupations, etc. You can find all these participants at places like local community shops or faith-based organizations, or even colleges and universities, where you can meet people and recruit them for your assessment. Number 5, all the data collection tools that are used must be translated into the languages spoken by the refugee and newcomer population. Data analysis will depend on the tool of data collection used. For qualitative analysis, you could go through the data to identify major themes and key findings and outline them. For quantitative data analysis, you could use data tools like Excel and Google Workspace, and you can use them to tabulate. And lastly, make sure that your findings are written in an easy to understand way and the literacy level of the whole audience is considered. Moving on to the tools of data collection. We'll start with desk research. A desk research refers to the process of gathering information and data from existing resources that are available publicly for everyone to access freely. For example, they're available on Google. You can access free books, free publications, free blogs, and free journal articles, things like that are free for access for everyone. This is why this technique is considered a very low-cost technique. Interns who are students may be particularly interested and suited for this process. Often, many internships require a finished project at the end of their term that was developed for the internship, and this could be in the form of a desk review or a research. Just like desk reviews, surveys are also a very cost-effective approach. They can cater to a large audience within a short period of time. There are different types of questions that can be used in surveys, including questions like open-ended and closed-ended questions. Open-ended questions are those that provide respondents with a question prompt and provide them a space in which to construct their own response. So for example, an open-ended question could be, what are some of the challenges that refugees face during their resettlement into the country? In this open-ended questions, respondents have the freedom to provide detailed and varied responses. Closed-ended questions, on the other hand, alternatively provide a question prompt and ask respondents to choose from a list of given possible responses. So for example, do you think access to education is a challenge for refugees? The closed-ended question will offer you responses like yes or no, and you would have to pick out of the two. This does not give you the space to give out a very detailed or varied response. Moving on, we have interviews. Interviews can give you access to high quality and in-depth data and also help you to build rapport with the community. For example, if you're interested in collecting data from the key informants of the refugee and newcomer population, interviews can prove to be beneficial to gather rich data that reveals insights into the experiences and perspectives of the participants. Focus group. It is when a group of people from the participants are gathered together to answer questions about a given topic. As is conducted in a group-based setting, it encourages people to speak up and share opinions depending on the topic. For example, exploring language barriers and communication challenges that refugees are encountering, or another topic like investigating the experiences of refugees in accessing essential services like healthcare, education, or employment. These are great topics to have a focus group on. On the other hand, if the topic of the assessment is gender-based violence, then because people would have to come up with personal experiences, a focus group would not be a great idea because it will prevent people from talking because of the fear of stigma. Let's move on to another fun activity. The question we have for you this time is, what challenges do you think your organization can have while conducting a rapid community assessment? So do you think your organization could have trouble setting aside a fund or a budget for the assessment? Or do you think it could face problems with hiring the proper team or training the proper team for the assessment? So we're getting a lot of people saying the budget is going to be one big concern. And then we have people saying time, limited time and resources. That's a very popular opinion. Yep. So yeah, we see funding and time, budget and time is a big concern. Let's move on. So the last section that I will be covering is common ethical considerations and best practices that are associated with a rapid community assessment. Moving on, yeah. In no particular order, we have stigma on mental health and personal problems, trust, do no harm, confidentiality, ethical conduct of research and oversight, trauma-informed care, sharing results with the community. And I'll be delving into their detail, a little bit of detail now. So we have trust and stigma. It is important to maintain an environment of trust before, during, and after an assessment has been conducted. This is especially critical whilst working with refugee and newcomer populations on sensitive issues like mental health because of the stressful circumstances they have been in. Providing an in-depth explanation of the assessment and taking permission before collecting data, taking consent before collecting data is very important. You can find drafts for various consent forms online. UNHCR has a very good one on their website. Link for that will be shared in the resource section at the end of the presentation. It is also very important that you share your results with the community. A lot of time people just extract the information from the community and they don't share what they've learned from the assessment or their findings. It is advisable that you share your report with the participants, and this will promote a long-term positive relationship with them. And it will help you build trust and collaboration and increase your collaboration with them. Many communities have stigma associated with mental health problems, which stops them from sharing and acknowledging their true feelings. Therefore, it is important for the service providers to be extra cautious when they discuss such sensitive topics with the community. It is also vital to remember to use culturally acceptable terms with the community so as not to offend them. Next, we have confidentiality and do no harm. Maintaining the confidentiality of refugee and newcomer population is very important. Therefore, you have to make sure that there are no identifiers or descriptors in any of your reports or published assessments. Adherence to strict ethical and legal standards to protect the safety and well-being of community members should be their priority. For any type of assessment, it is also imperative to ensure that any questions asked do not harm the participant in any way. The questions should not be intrusive, and maintaining the well-being of the respondent should be the top priority above all. Any indication by a participant about distress should be properly mitigated. Refugee service organizations should set out clear guidelines for handling high-risk cases before starting the assessment. Now we have ethical conduct of research and oversight. Ethical conduct of research and oversight is crucial to ensure the protection of participants and the integrity of the research process. If you're planning to conduct research involving human subjects, it is important to consider the institutional requirements set out by the Institutional Review Board, the IRB. An IRB is an independent committee responsible for reviewing and improving research protocols involving human subjects. Many institutions and agencies have their own IRBs, so it's important that you consult them before taking your assessment to the ground. And lastly, we have trauma-informed care and the 5 guiding principles of trauma-informed care. Trauma-informed care is an approach in the service field that advocates for the understanding of physical, mental, and social impact of trauma on the individual and the professionals that are helping them. When working with refugee and newcomer population, it is important to remember the 5 guiding principles of TIC. They are as follows: safety, making sure physical and emotional safety of participants is taken care of. Choice, participants get to exercise choice and are aware of their rights and responsibilities. Collaboration, participants share power and are involved in all aspects of decision making. Trustworthiness, all the information regarding the assessment should be shared and boundaries must be respectfully maintained. And number 5, empowerment, making sure to prioritize empowerment of the refugee and newcomer population by creating an atmosphere that allows them to feel validated by the service organization. I will be handing over the mic to Dr. Karin Wachter now. Thank you, everybody.
Everyone, and thank you, Ramsha, Mary, and Switchboard for inviting me to participate in today's webinar. I'm excited to be here with you today. So before I dive in, I wanted to give you a little sense of my background and what I'm bringing to the discussion today. I have a professional background in international humanitarian assistance focused on responding to violence against women in war, forced displacement, and post-conflict settings. It was my engagement with research on the job that inspired me to do a PhD in social work and ultimately join Arizona State University as a professor, where I now conduct research focused on violence against women and social support and forced migration and refugee resettlement. And I also conduct research focused on provider well-being. At ASU, I teach research methods at different levels and an elective on global perspectives on violence against women. When I was a humanitarian aid worker, I was part of a different community. I was part of different community assessments that dealt with sensitive topics with very vulnerable communities. I had some training along the way, but I believe what allowed me to be successful in doing this type of practitioner-led analysis really came down to my ability to convey my desire to understand, to ask good questions, to listen carefully, to deeply consider the ethics of collecting and sharing information, and finally, to take a step back and think analytically. I'm sharing that with you because I believe that many of you here today have the skills and qualities that position you to conduct thoughtful and ethical community assessments with the populations you serve and care about. And I want to encourage you to keep expanding and honing your skills as lifelong learners. So today I'm going to share examples from 2 studies that I've been involved in that assess communities using different methods. The first example was a rapid assessment of provider well-being during the COVID-19 pandemic, in which we surveyed staff employed by local refugee resettlement agencies. Our aim in conducting the study was to rapidly identify and highlight issues and needs related to well-being in the specific workforce. We set out to conduct this survey with a large hospital system, and at the same time, we were concerned about the health and well-being of folks working in refugee resettlement, so we extended the study to include resettlement agency staff. Our data collection method was a survey programmed in Qualtrics that included standardized instruments, team-developed questions, and open-ended questions. In the end, we had 60 people complete the survey. We had a little internal grant from ASU that we mainly put towards participant incentives. We had approval from the ASU Institutional Review Board to conduct the study. And after providing people with information about the study, we asked them to provide their informed consent before starting the survey. So one of the things we do in research, including community assessments, is figuring out the population we want to engage. Sampling is an important consideration because it shapes what you're able to say about the results. When we use non-random sampling approaches, we can only talk about how the results represent the experiences of the people who participated in the study or assessment. In other words, we cannot claim that the results are representative of a broader population. This is really important to keep in mind as you move forward with your own assessments. So in this case, we used a non-random sampling approach. We had very clear criteria for who we wanted to have participate. For example, people had to be 18 years old or older and currently employed by a resettlement agency. With the help of our state program, we sent 3 emails containing the survey link to the leadership of 5 refugee resettlement agencies to distribute among eligible staff. The emails indicated that people who completed the survey could enter their email addresses into a drawing for an Amazon gift card worth $15. The survey contains 69 questions in total, including demographic questions and quantitative measures of well-being, burnout, turnover intention, stress, pandemic-related concerns, and coping strategies, among others. We also included 8 open-ended questions that invited people to elaborate on effects of the pandemic and other factors on their well-being, and to talk about their self-care practices and their recommendations for addressing staff well-being in the workplace. So just a quick note about closed and open-ended questions. A closed-ended question is one that lends itself to a predetermined set of answers, such as yes or no, or a Likert scale, from strongly disagree to strongly agree, and so on. Typically, closed-ended questions are used to produce quantitative data, meaning the responses are easily transformed into a number, which can then be used to run statistics. A straightforward example of a closed-ended question we included on our survey is the one included on the slide here. In contrast, open-ended questions are used to collect qualitative data, such as the one that we included in the survey that's on the slide. People wrote in their responses, and then we analyzed those using qualitative data analysis techniques, not statistics. So let's take a moment to talk about quantitative measurement. We actually use quantitative measurement tools in our everyday lives. For example, a bathroom scale measures our weight. We use a blood pressure cuff to measure blood pressure. We use measuring cups to measure the amount of flour we want to make cookies. These are tools that we rely on to produce accurate numerical data for different purposes. But it gets a lot harder when we want to measure concepts or lived experiences such as physical activity, depression, stress, or supportive supervision in the workplace. Because measurement is complex, whenever possible, we use existing standardized measurement instruments that have been carefully developed and tested, at least with some populations. These are a few, just going back to the last slide, these are a few rules of thumb when considering quantitative measurement tools. Always make sure that the instrument matches the concept you want to measure. For example, don't use a depression scale to measure burnout. Always look for instruments that are free of cost and don't require special permissions to use. Carefully assess the relevance, the quality, and length of the instruments. Actually read the questions and see if they're going to make sense for the people that you're going to survey. And finally, before you include a particular scale or index in your survey or questionnaire, wrap your head around how you're going to analyze and interpret the data that's produced and what that data will actually mean in the end. All right, I'm going to give you just an example. So in our survey, we used a standardized, short, and publicly available instrument to measure perceived stress. The PSS-4 has been used widely in research. We chose to include it in our survey on staff well-being because we wanted to measure stress. The PSS-4 is considered a valid and reliable measure of perceived stress, and honestly, because it was short. We were really concerned about the time and energy people had at this point in time during the pandemic to complete the survey. On the next slide, we'll see that there are the 4 questions that are included in the measurement tool that measures perceived stress. And you can see the response options, which range from never to very often, and also the numeric value that corresponded with each one of those response options. So this was the tool. All right, in the next slide, we'll see that we had 60 people respond to those 4 questions, as well as all the other measures we had in the survey. We summed the responses per participant, and then we calculated the average or mean score of stress based on all of the responses. We then also compared stress scores between different categories of workers. Caseworkers and therapists was one category, supervisors and coordinators were second, and people in senior leadership roles was our third category. The average score for the full sample was 7.3. And this may appear low considering that the highest possible score for any one person was 16. But what was even more surprising was how the scores differed by category of position, with direct service providers reporting the lowest levels of stress and supervisors and coordinators reporting the highest. We didn't predict those results, and I'm sharing that with you because it serves as a reminder why it's important to challenge our assumptions and remain open to what the results tell us, and to then critically think about what may be going on. It is always possible that the measurement instrument didn't work for some reason, maybe due to a particular group of participants that you're using it with or the circumstances at hand. So you can't always find standardized instruments that measure the concepts you're interested in. As an example, we were interested in how people rated specific pandemic-related concerns, and we had to develop those questions for the purposes of the study because there wasn't a standardized measurement tool that had been developed yet because we were still in the thick of the pandemic. So based on our review of the literature at the time, our close connections with practitioners, and our own experiences of living and working through the pandemic, these were the questions that we came up with and the response options that we provided. We did start with a long list of concerns, and we ultimately whittled those down to what we believe were the most pressing concerns at the time. So again, we summed our responses with higher scores indicating more concerns, and we calculated the mean scores. Again, we had some pretty interesting results. The 3 areas of concern, the greatest concern were client hardships, health of loved ones, and being cut off from family and friends. This time, people in leadership reported the highest level of concerns, and we found significant differences between how people of color reported pandemic concerns in comparison to white workers. So in terms of our dissemination, as quickly as possible, we drafted a brief that described the study and our key findings. And we shared that brief with the participating agencies and offered to meet with them to debrief and discuss what we had learned. In the research brief, we included recommendations for taking action. And this study ultimately informed future interventions and studies focused on resettlement agency staff well-being. The journal article displayed here reports the results from the same survey that we conducted with health workers. And I thought it would be interesting just to give you a sense of the time that was involved on the next slide. This assessment was relatively rapid, and yet it still took us approximately 6 months from start to finish. So it's a consideration of time, and I saw that in one of the activities that time definitely came up as a concern for conducting community assessments. And indeed, these do take time, so that's an important consideration. All right, so I'm going to now share a second example. The first example was of a study that used primarily quantitative methods to rapidly assess service providers. Now I'm going to share a second example of a study that used primarily qualitative methods to assess needs in a client-based population. Our aim was to generate knowledge on the service and support needs of refugee and immigrant women who had experienced intimate partner violence, or IPV. We used individual interviews and focus group discussions to collect data. We had 88 individuals who participated in the study. The study was funded by the federal government, and we had ethical oversight from 2 different universities. Again, we used a non-random sampling approach that was based on clearly defined inclusion and exclusion criteria for 3 different groups of participants. Our first group were women who were settled to the US and had disclosed IPV to their resettlement agency. Our second group were women who were settled to the US in general as refugees. And our third category were service providers who serve the refugee and immigrant community. We used different recruitment strategies per group of participants because we had to access those groups differently and screen them differently. And we provided transportation and gift cards to the participants in groups A and B. We used different data collection methods based on the types of questions we asked per group. So I know Ramsha already gave an example of when it would be appropriate or not appropriate to use interviews and focus groups, and specifically with the example of gender-based violence. So in this case, we conducted individual interviews with women who had disclosed experiencing IPV because we wanted to ask them about their help-seeking strategies and who they went to for help. And so that was very personal and very, very sensitive, and we couldn't do that in a group setting. However, it was appropriate and beneficial for us to speak with groups of women to talk in general how people think about help seeking for IPV and what options are available to women when they've experienced IPV in the community. So it's again to say that our methods, our data collections have to match our questions and the population included in that group. So our analysis generated 4 overarching themes, each of which had multiple sub-themes. I will share with you the link where you can read the findings if you're interested in the topic. But I'm sharing this with you because obviously the description of broad themes based on interview and focus group data are very different from the examples of quantitative results that I shared in the previous example. So numbers can be compelling and convincing, especially if you're concerned with the scope of a problem or need. And qualitative findings can describe needs with important nuance and context and create a platform for amplifying the voices of clients, communities, as well as service providers. In any case, your data collection methods have to match the purpose of your assessment and what you set out to learn. And to hopefully demystify what goes into qualitative analyses, I laid out these 6 steps just to give you a sense of what it takes. We go through this. This is based on an approach that we call thematic analysis. And basically, the approach requires us to familiarize ourselves with the data, which means reading the transcripts in great detail, breaking it down into chunks, interpreting what that means, organizing those chunks into broader themes, interpreting what those mean, and then drawing conclusions. It can be a very intensive, time-consuming process, and it requires specific skill sets. In fact, all data analyses do, but there are particular considerations in conducting qualitative analysis that you have to think about. For example, you have to think about how are you going to get your data into a format that can actually be analyzed. And again, you want to make sure that you have the right skill set on your team to be able to guide the process, because it's easy to get lost along the way. So in terms of dissemination, again, we wrote a research brief to get the findings out as quickly as possible that synthesized the key findings from the study. And we specifically were targeting practitioners in the research brief. And it's available by clicking the link in that first bullet point and also in the chat. We then went on to write several articles in which we expanded upon the key findings, which are listed here. If you have any trouble accessing any of these resources, please don't hesitate to contact me through ResearchGate or by email. Finally, I wanted to share with you some of the lessons that I've learned from conducting community assessments and other types of studies, and from teaching research methods to my students. Always clarify the purpose, aims, or objectives of your assessment. That's what will keep you on track and making sure that you are staying on track. It's really important to think through the entirety of the project, including data analysis and dissemination. All of us tend to think about the data collection part. It tends to be the most fun and thought-provoking part of the project, but it's important to think of everything that goes ahead of the actual data collection, everything that follows. I really encourage you to explore partnerships to fill in gaps in skills or knowledge. It's okay if you as an individual, or you as a team, or as an organization are missing skills and knowledge. Partner with people who have those skills. Find the people who are excited to work with you. And that's what will set your project up for success. Always use caution in how you're interpreting your results, and carefully consider the time it takes for design, implementation, and analysis. So I thank you so much for your time and interest, and for listening to me today. I will now hand it over to Mary for the rest of the session.
Thank you so much, Dr. Karin and Ramsha, for the really wonderful presentation today. Really appreciated the background information that Ramsha provided, and then Dr. Karin bringing these key ideas in terms of community assessments to life through the examples of the research that she shared. Right now we have time. We have a good amount of time for question and answer. So I want to invite all of our panelists today to share their video, and we'll segue to our question and answer period of today's webinar. So please feel free to type any questions that you have into the Q&A, so that we can bring those up for group discussion. And we've already had a couple that have come through the question and answer portal during your presentation today. So I'm gonna start with those, and then we'll see if additional questions come in. One, I think really important question that we can all relate to is, it comes from one of our participants, related to how can refugee resettlement practitioners who aren't in academia, who don't have particular, training and monitoring and evaluation, for example, how can they really work this rapid community assessments into their work? Even when they really want to do so, but given the many competing priorities and the budgetary and time constraints. So I wonder if we can brainstorm as a group of panelists today and think through this important question, which I imagine is something that a number of our participants today can relate to. So Karin, maybe I'll ask you if you have any initial thoughts in response to that question.
Yeah, I appreciate the question. It's a great question. It's a great question for practitioners as well as academics and researchers who are interested in partnering with folks who are doing the work on the ground and interested in engaging in some sort of data collection or community assessment. I would say that what's so important is to actually start the relationship building as soon as possible. So even as part of your strategic plan for the year or your goals for your program, it would be great if you reached out to a couple of researchers who may be working locally or in your state, who are committed to some aspect of what you do, whether it's by topic or by population or something else, and to start engaging with those folks, to start brainstorming ideas so that the relationship building process is already underway. You start to know one another, because I think what's so important in these types of partnerships is the trust, knowing one another before you dive into an actual project, because there are always things that come up. Things, for example, things always take more time, more resources than we can ever imagine. So it's important to have that foundation, I think, for a good relationship before you start actually getting into the actual project. But that's just the first thought that came to my mind, how important the relationship building piece is.
Yeah, I think that is such a great point. And And just, yeah, echo your suggestion that I think in that case, really working collaboratively with people who perhaps have more time to dedicate to the assessment itself. And maybe in that case, the role of the refugee resettlement practitioner and partner as an advisor, is consulting on the overall project. So really coming at it in terms of sharing responsibility for conducting the assessment. Ramsha, anything you would like to add to that?
No, I think Karin pretty much covered it up, and yeah, I agree with everything, that it's very important to build relationships like this.
So now the questions are coming in. We have a number of questions, so I'm going to just keep us moving along. Earlier, we had a question, Karin, about if you could say more about chunks and how do you determine and organize the chunks?
Yeah, it's tough. Every one of those slides could have been a 2-hour class or a semester-long class. So it's hard to kind of find that right balance between kind of getting a sense of what these things entail and being more concrete about it. So let me try without getting lost in the details. So typically when we are analyzing qualitative data, not always, but typically we do it by text. So we have to first transform, any type of audio recording that, of course, you have the permission to record with your participants. And then you have very clear guidelines around how you're going to keep that audio very safe. Typically what we have to do, we have to transform that audio to some sort of written text, right? So we call that transcription. That is something that takes a lot of time. You can pay professionals to do it. That can get costly. So these are all kind of resource considerations. All right, but then imagine you've just had an hour-long interview with someone, and you've taken the audio recording, then you've had it transcribed. So now you have a 15 to 20 page document, Word document, and you read it through, and you're seeing, okay, those were my words as the interviewer, and then these are the words that were conveyed by the person who participated in the interview. And then you go through that process of really familiarizing yourself with that text very, very deeply to understand it and to really be paying attention to the words and meanings that the person is conveying. And then what you're doing is you're trying to, you need to manage that, because if you imagine you conducted one interview that's 20 pages of text. Now imagine if you conducted 15 interviews, 20 interviews, 50 interviews. Can you imagine how much data that actually ends up being? It's a ton. So what we do in qualitative data analysis is we manage those data. We try to reduce the data. And one way of doing that is to capture what people are conveying to us, whether it's feelings, ideas, perceptions. We capture that in just a couple of words. We can call that a code. We can call that a theme. It doesn't matter what we call it. I've called it a chunk because I was trying to not be jargony in my language. And then we try to interpret what those chunks or codes or themes mean, and then we group them together to see, do we see trends and patterns in the data? So I hope that helps explain a little bit further.
Absolutely. Great. Yeah, as you said, any of these could be a whole course unto themselves. And I want to remind everyone that at the end of our presentation today, we do have a list of resources, including additional resources that you could look into on qualitative analysis and different approaches for qualitative analysis. So we just encourage you to read those further. We've got another question around, excuse me, sorry here, around any proposed solutions to challenges such as digital literacy for surveys or interpretation needs for focus groups.
Mary, can you just set us, I just want to make sure that I understood or heard the question. So could you either start us off or read it
Sure,
again?
yeah, let me start us off. So again, the question was around proposed solutions to challenges that you might face conducting rapid assessments with refugee and newcomer communities, and those might be digital literacy, lack
Okay,
of
thank you.
familiarity or interpretation needs for focus groups. So why don't I kick us off by saying, in terms of focus groups, some of the way that I've approached this in my own work, and I think there's different ways to go about this. One, of course, is to work have members of your team who speak the language of refugee and newcomer communities that you're working with. And I think, that this can often be a really ideal approach because it allows for a free flow of conversation. That individual may be able to capture nuance and expression of ideas and language that might be difficult to capture otherwise. Of course, the other alternative is that you utilize a trained interpreter to conduct a focus group. I might suggest, if you were going to go the interpreter route, to do so more with an individual interview or perhaps a dyadic interview or small group, just because interpreting live with multiple people in the room can get very, very complicated. I don't know, Karin, if you have additional suggestions relative to digital literacy or the interpretation question.
Yeah, it's a huge consideration, and often you have to think very carefully. So you have to think about access. Are you actually going to get the folks who need to be responding, or who you would like to invite in and have respond to a survey, for example, online? Will they have access? Will it make sense to them? Will they want to do it? Will they be compelled to do it? And if not, if there's any questions around that, first of all, you can do some kind of just informal so-called data collection to get a sense, of the willingness and the ability for folks to do things online on their own. Or will this take actually sitting down with people and perhaps administering the survey orally and having them respond orally? So that those are all different options that you have to consider.
Right, absolutely. There's another question around focus groups, just building off this question of focus groups and thoughts that we all might have about conducting those virtually, and any challenges that we might anticipate with conducting focus groups virtually.
I think I would have answered that question very differently several years ago, pre-pandemic. And I think what we learned during the pandemic is that we can do a lot, right? We can do a lot by phone, we can do a lot virtually, and that it works, right? It can work really well. So I think it has to do with your population and access. Sometimes the access question, if it's going to really help gain access because people are busy, like the fact that people would, instead of having to travel somewhere in order to participate in an 1.5 or 2 hour focus group plus travel home, maybe that's going to prevent them from participating, but they're willing and able to jump on and do an 1.5 Zoom. Personally, my personal preference is to do as much in person as possible when it has to do with qualitative individual interviews, in particular in focus group, but we've seen it work really, really well in the virtual space.
Yeah, the only thing I was thinking of, Karin, to add to that are just potential challenges with confidentiality, because it's harder to have a total handle on the nature of people's private spaces when they join a Zoom focus group. So that would just be one additional consideration. I want to now raise a question to our panelists that came through, which is, how can you decolonize the data collection and allow for other forms of knowledge such as art and storytelling?
Yeah, I think that's super important, and that should be a discussion in and of itself. There's so many options. I think where we started today was it was a starting point. And I love that question came through to kind of, break it open, that we don't need to just be, thinking in terms of surveys and individual interviews and focus groups, but we can get so much more creative in how we invite people to share in a way that helps to equalize power dynamics and to really give voice to folks who have something to say and want to share their voice. So I think we have some interesting examples of that. Mary, I know you're doing some really interesting creative work around that. Maybe you can share your example.
Sure, yeah. What comes to mind is actually building on this topic of focus groups, but we were really interested in engaging with youth who had arrived as refugees with their family and thinking through the best ways to perhaps engage them into a focus group process. And so we really drew on more creative methodologies and what we would call photo voice. And one of the exercises, for example, that we had youth conduct is to work in small groups to write a letter, a group letter on big white paper to another young person who they would imagine coming to the US from their country of origin, their same age, their same gender, and what would be some of the things they would want to tell that person to expect. Yeah. And then in the second part of the letter writing exercise, we asked them what advice would they give them? Given this, what advice? And so that really provided a rich way to learn more about the youth's lived experiences themselves, their perspective on the adjustment and resettlement process, but it also really enabled them to work together in small groups. And so these also then resulted in these really artful letters that the youth felt proud of and interested in. So there's lots of different ways for people interested in this. I think looking up photo voice methodologies, art therapy approaches, those could be some different resources for people interested in that. Let's see here. So we have a question. Excuse me, I was just digesting it. So we have a question from somebody who identifies as not a professional researcher, but is somebody who has studied research and has a basic foundation on how to create questionnaires and needs assessment, and is really interested to do so in their community. And their question is, how can I gain the confidence that my assessment will be done correctly and will be done accurately? And in fact, this as we were giving our presentation today, one question that was coming up for me that I was hoping to engage our panelists around sort of relates to this, but was about training and preparation for the people that are going to conduct rapid needs assessments. And if it's okay with Caroline, I thought I might put her on the spot since she's really immersed right now in the process of training data collectors for our work with newcomer families from Afghanistan. So I wonder what your response to that would be, Caroline, around gaining, how do we ensure that this is done with ethically, correctly? So yeah, eager to hear your thoughts on that.
Yeah, I mean, kind of going back to what you were saying earlier about language, in our particular rapid community assessment that we were working on, we engaged with case managers who spoke Dari and Pashto so that we could assess the Afghan population, resettled population, about problems that are experienced by the children in their community. So with our training, we essentially had probably about a week long in total training where we just discussed the basics of research as well as the importance of ethics in research. And then going from there, we discussed the specific methodology and did a lot of role play, which was really helpful for those who were, non-specialists in research. So it wasn't hard to pick up. Our researchers did a fantastic job. So I think that you can gain confidence just by, learning the basics, but also just practicing was really important. So making sure that you give space and training for role play and practice.
Yeah, so important. The other thing I was thinking of, Caroline, is also just that ongoing support that you're providing on a weekly basis. So that upfront training is critical, but you also want to have regular check-ins with individuals that are collecting the assessment data so that you can troubleshoot, problem solve around difficult issues that came up. So I think, yeah, both of those things are essential part of really preparing people to do this work well. Anything you wanted to add, Karin?
Yeah, I would just want to reiterate the importance of building your team. There's no reason to do this alone. Connect with people who are either just enthusiastic and want to do it, and folks who have done it before. And it's through practice, I think, that we gain confidence to see that it works and to expect that not everything will work. No matter how well we've planned it out, how well we've designed it, how well we've done to engage communities in the design and in the implementation of these types of things, something will always not quite work out for one reason or another. So just expect it. There's no such thing as the perfect community assessment, rapid or not, and to build your team. Don't do it alone.
Great, thank you. One question that I was going to ask Karin for you to maybe expand upon in this part, since we have a little bit of time. You spoke a lot in your examples about the importance of thinking through what your inclusion and your exclusion criteria were. And I wondered if you could just say more about that. You know, how might you think about, particularly if you are going to conduct maybe a qualitative assessment and you have a limited budget, a limited amount of time. So how might you think about what might be some of the important decision points to make around who you might be really aiming to hear from in your assessment?
Yeah, and Mary, help me out here, because I'm sure you have lots of good thoughts too. But I think all the key, it really comes back to this question of your study population. And wanting to ensure that you are intentionally, mindfully creating access points for folks whose voices are absolutely crucial to the learning endeavor and whose voices may not be necessarily so easily heard, either because of marginalization, language, whatever the case may be. So I think it's such a crucial piece. Again, I think we always like to jump to data collection, how we're gonna collect the data, but just thinking through even how do we think about who the population is, who are we hoping to engage, how do we make sure that even within that population that we're engaging the folks who are, it's really important to have them participate, and then be thinking about those inclusion, exclusion criteria in ways that just help. If they're too detailed, I think it can be cumbersome, but they just help really narrow who it is that you're trying to focus on. And then, of course, your recruitment strategies, I think, are going to help so much. So some real key things. Age is going to be really important. So when you conduct data collection with and recruit folks, who are, at least in the US context, under the age of 18, there's special considerations for having consent to be able to collect data with those populations. So there's going to be different considerations. Are you looking at folks who are above 18 or adults or minors? So age is an important one. I think thinking through their experiences, is it really just anyone who you want to talk to, or there's certain life experiences that are really important to make sure that they've had in order to get the information and lived experience kind of informing the data that you need. And then other demographics in terms of race, ethnicity, whether sexual orientation, gender, all these things I think are so crucial to be thinking about just in terms of shaping your study population. So Mary, tell me what I've left out.
No, that's fantastic. It was also reminding me of what you were saying earlier, which is that this kind of initial relationship building, because much of what we're talking about today is in the context of newly arriving, potentially refugee and newcomer communities, and using community assessments as a way to better understand need, to elevate voices. And so we want to really also position ourselves in the learner role, and that perhaps a first step is really those relationships building and those exploratory conversations to better understand then who are the folks that we really need to engage in this community assessment process. So just wanted to reemphasize what you said earlier in relation to that. Yeah. So it looks like we have we have come to the end of our questions for today. So I want to take this as an opportunity to first really thank again the wonderful panelists today for providing such an enriching webinar. Really thank Ramsha for kicking us off, and Karin for sharing your research work and experience and helping bring to life some of these principles about conducting community assessments that otherwise can feel hard to grasp. So we really had practitioners in mind for this webinar, and we hope that this information has been practical and useful, and people feel better equipped to think through community assessments that they might undertake. So just to recap our learning objectives for today. So we were hopeful that by the end of today, you would be able to better describe what a community assessment is and why you might want to undertake one. Second was to describe how to prepare for a rapid community assessment. Again, that relationship building piece, I think, has come through as an important theme today, along with determining who you want to engage from a sample point of view, thinking about the different methodologies Ramsha presented us, and then also really recognize common ethical considerations while conducting rapid community assessments, certainly remembering when we're engaging with newcomer families or communities that they may be facing certain vulnerabilities, and we want to be very mindful of those. And then finally, name at least one practical application of rapid community assessments. And Dr. Karin has given us a number of wonderful examples to think about that. So those were our objectives. Now we'd like to ask you to help us. Please scan the QR code that you see here or click the link in the chat, and please complete a short 3-question survey. This is kind of a meta moment for our community assessments webinar. And this will take you literally less than 30 seconds to complete, but really helps us hear how this was for you and how we might improve our technical assistance and trainings moving forward. So we'll just wait for 30 seconds now to give you a chance to complete that survey. And here you see a number of you asked about where can I learn more about community assessments? How might I read about a community assessment? So on this slide and now also in the chat, you have a link to a number of resources where you can learn more about different types of community assessments. And we hope these resources will be useful to you. And all of these slides will be sent out to the participants by Switchboard after today's webinar. And now with that, I will turn it back over to Rosalie.
Thank you so much, Mary. Thank you to all of our learners today. For more training and technical assistance, stay connected with Switchboard. Email us at switchboard@rescue.org or visit us at www.switchboardta.org and follow us on social media at SwitchboardTA. On behalf of all of us here at Switchboard and all of our presenters and hosts today, thank you for learning with us, and we hope to see you again soon.